Hello, everyone. This is Dr. Sarah Taysir. I'm a pediatrics and neonatology specialist and healthcare consultant on MedSynapse medical platform. Today, I'm pleased to have Dr. Mahmoud Bravo as my dear guest. Dr. Mahmoud Bravo is a healthcare marketing and communication leader and executive coach as well, DBA and MBA holder. Hello, Dr. Mahmoud.
Hello, Dr. Sarah. First of all, thank you for the introduction. I'm really humbled and I'm very excited being with you today.
Me too. First of all, I would like to know more about your background, your medical background, and this sort of career shift you have done.
Okay, let me start that I'm a pharmaceutical science graduate. I'm graduated from pharmaceutical science with my bachelor degree. Then I joined the pharmaceutical industry as a medical representative, where I moved into marketing as a marketeer. I took many steps in marketing, including marketing associate, brand manager, group product manager, regional marketing manager.
Okay.
And that was the part where I was really triggered into the science of marketing, the art of marketing, and all the bits and parts related to human psychology in marketing. So I invested too much of myself, where I started to learn my master's degree, my doctorate degree.
Okay.
And there where I turned to be a consultant marketeer for many of the pharmaceutical companies, local and global pharmaceutical companies.
Okay.
And subsequently, they started asking me for training programs, and this what turned me into a trainer. So that's an overview of my career path.
This is great and actually unique for pharmaceutical candidates and pharmaceutical graduates, because it's a bit different than I see with my colleagues, with my pharmaceutical colleagues. So this is really, really unique. And by the way, I love your speech so much. It gets me motivated. Yeah, I love it so much. So let me first ask you about what are the biggest trends you see shaping healthcare marketing in the next few years, since you're an expertise.
Let me say the first one is the digital transformation. Digital transformation is massively impacting the market. And considering that specifically the healthcare market was a bit away from the digital part, so the transformational impact is way bigger in this specific market, much more than other markets. That is one. And the second thing is the part related to patient centricity. Today, the patient is not by any means the patient that we saw 10, 20 years ago. The patient is an integral part of the decision making. So in our entire plans in the healthcare, we have to put the patient in the center of everything. So those are the two main things. Plus, regarding the medicine part, we are transforming more into specialized medicine, personalized medicines, and a major shift in innovation. Where today the mass market products are not the key. They're just commodities in the market, but the entire market is shifting to the specialty products.
So what are the unique challenges healthcare marketeers face compared to other industries? Example, I mean regarding regulations, data privacy.
Okay, first of all, the first challenge that they are not marketeers.
Okay.
And that's the major challenge. Let me clarify this point. Okay. Most of the people doing marketing in the healthcare industry, originally they're not marketeers. They're science graduates, pharmaceutical science graduates. So they work as medical representatives. They're good medical representatives, sales personnel, and they transform into marketing. And this is the time they need to realize that they need to learn the science of marketing. It's not something only acquired. There is basic knowledge they need to acquire. The second challenge, I would say, of course, the regulation part. When talking about global regulations, local regulations, Ministry of Health regulations, that's very challenging. A lot of things you can do in FMCG, you can do in the healthcare industry. Last but not least is the compliance and regulatory part.
Yes.
Because if I make one single mistake on the social media and a wrong piece of info will reach the public, the organization may pay hundreds of millions for a fine. So people are very, very much critical about this.
Yes, can't agree more. Okay, and how do you think healthcare providers leverage different marketing channels to connect with patients?
I would answer this question into two parts.
Okay.
What's the role model and what's happening on ground right now?
Okay.
What's happening on ground right now is the multi-channel marketing. They are utilizing different channels. The offline channels and online channels. I would not go into the depth how are they utilizing it. Some practices are really good and some practices are absolutely malpractice. But when looking to the role model, they should and they must shift to the omni-channel marketing, where every channel should take the patient another step to the next channel. The next channel will take him to the third channel to make sure that the patient is living in a journey within the healthcare system.
Yes.
And a lot of global organizations are working on this right now. And I do see some progress, not the optimum, but there is work on ground.
There is hope. So I from my point of view, I'm a doctor, and regarding marketing, I had no idea what's healthcare marketing is. I'm studying now healthcare diploma at the AUC, business school AUC. So part of my diploma is about the marketing, healthcare marketing, and I have actually a blog where I market for myself and for my services. And it turned out that healthcare marketing is way different that all doctors do on social media actually. So yeah. Okay. So how can healthcare marketeers make patient experience a priority through marketing, through the marketing journey? How can it be like a priority?
Let me start that every professional healthcare marketeer, his entire plan is built upon the patient journey.
Yeah.
So with me working in different companies, in different corporates, in different countries, every time I set a plan, I spend a lot of time and energy, not only me, every professional marketer would do this, to build the patient journey, to understand exactly what every step the patient would go through in his journey in the treatment until the end of care or the end of life in terms of chronic illnesses.
Okay.
And according to this journey, he starts to articulate his plan all around it. So starting with, if for example, a very silent disease like hypertension, and people would not normally know that they're hypertensive unless there is a critical episode or just by coincidence.
Yeah.
So I would need to work on the awareness level. Then in the diagnosis part, I should work on the educational level. And in the treatment part, I should also work on the educational level where the people need to be aware that hypertension is a chronic disease. Many times in my career, I've seen patients dropping out of the treatment as soon as they feel good.
Yes.
They treat it as just an acute disease while it's a chronic one.
This is really
so
important.
The patient journey is the core. And utilizing today's channels, digital channels especially, there is a lot of ways, including artificial intelligence, social media, blogs, websites, mobile applications, where it can keep the patient educated, engaged, aware, and it can really enhance his role within the journey of the treatment.
Okay, and do you think, it's a question for me actually, do you think that every doctor on social media has to link with a marketeer or has to get back to a marketeer, so they should know how to promote for their services or help them throughout the marketing of their healthcare service? Because, for example, when I started to market for myself, I started 4 or 5 years ago, and I just started to make videos. It went well, and I'm happy with what I have achieved so far on social media. But yet, I guess I still need to learn more about, what you said about knowing the patient or my audience better, what they need, what the journey of the patient. So do you think that we as doctors, as physicians, we have to have a marketing plan in order to succeed on social media?
This would be, to be very honest and transparent, this is according to your objective.
Okay.
So if I have just a simple objective to keep connected with my patients, I don't need to have a marketeer.
Okay.
I just need to be connected. I need to shoot some videos, post them online, and have the simple interaction. But if, for example, I own a hospital, a clinic, or a series of clinics, and I need to professionally market for them, or professionally marketing for myself, for example, building a persona, I need to build a brand persona for Dr. Sarah. Then you need to find a good qualified marketeer to help you do this. Because what happened, as you mentioned, you started and you succeeded, right? And that's by coincidence. You just went for the common sense. And normally common sense is right. It will work. But would the common sense get the full potential? The answer is no. Here where you need the science and the practice of marketing.
Yes.
So it's according to your objective.
Okay, good answer actually. Okay. So what are the ethical considerations healthcare marketeers need to be aware of when they promote their services?
If I would consolidate it into two simple words, number one, never promote a misinformation, a wrong information, because this information would impact the life of a human being. And second thing, don't be manipulative. Sometimes people are very, very much excited about the product and they would claim that this is the best product in the market. But if you don't have a reference, a clinical data to say this, don't say it.
Do not.
You
Yeah.
can say I'm better than X, Y, and Z as per data, but in healthcare marketing, we should not tend to go to any extremities. We should be very logical and make sure that every word is referenced, because this impacts people's lives.
Yeah, sometimes I refuse some campaigns because I don't have any info about the product, or I didn't try the product with myself. I mean, I'm a pediatrician, so I have to try it on my kids as well. So some companies and some agencies are like, they say I'm not, I don't want to work, I don't want to gain money and do money. But as you said, I'm a
Only
doctor. I
that you
have
have
some ethical.
ethics.
Yes, yes. So you're right. Okay, and what are some common mistakes you see healthcare providers make in their marketing efforts?
They tend to oversell things in terms to achieve bigger objectives, and normally this will fire back at them.
Yeah.
So sometimes they would go into promoting that they are the best or providing the best service, while sometimes they are outdated. So I can't do this. Secondly, they started going into price wars. So
Yeah.
the lower my price I'll go, the more people I will attract, and that is wrong. At
Mhm.
the end of the day, in healthcare, this is a very, very eminent role.
Yeah.
And we're not promoting a service. I'm not promoting a service, a car care service. I'm
Mhm.
promoting a human health care service.
Yeah.
So that's the people should be very neat with this type of service they're delivering and the type of promotion they are conducting.
Okay, and what do you advise new doctors who wants to start marketing for themselves without getting back to like marketing agencies or stuff like this? They just want to have a good start. One advice that you would say to them to encourage them to start, and that would be a good one, a good advice.
That's an advice actually that applies for anyone in life. Today, the sources of knowledge is available at our fingertips.
Yeah.
Everyone has a mobile phone. You can Google anything you want and you can reach the data.
Yes.
The essence is that you have the hunger to learn. So
Mhm.
actually, if I would talk to any doctor, if you want to start marketing, it's fine. You don't want to